CDC just issued an urgent warning to all international airports in America about a virus with a 75% fatality rate, 25 times higher than COVID-19. This virus is called NIPAH, and it is silently spreading from Southeast Asia. With more than 2 million Americans flying to this region every year and numbers rising rapidly after the pandemic, the possibility of it appearing on American soil is no longer a question of if, but when. WHO has placed NIPAH on the highest priority surveillance list for 2026, right next to Ebola. Before we dive into this video, I need to ask you to watch this all the way through so you can understand how to prevent this dangerous virus and share this knowledge with those around you. And that is also my purpose in making and spreading this video. Listen to this story. In September 2025, a 47-year-old man in Kerala, India flew home after visiting family. He had mild fever symptoms, thought it was just a common cold. Within 5 days, he had infected 12 people in his family and community before doctors realized it was NIPAH. 4 of them did not survive. According to new research from Harvard Medical School, NIPAH can spread through the air in enclosed spaces, just like COVID, but it is far more dangerous because it attacks the brain directly. Currently, there are about 4.5 million Americans of Indian and Bangladeshi descent living in the US, many traveling frequently between countries. On top of that, hundreds of thousands of American tourists visit Southeast Asia and South Asia every year. The CDC has already begun training major hospitals in California, Texas, and New York on how to identify and isolate NIPAH patients. This is not a joke, and this is why you need to know what I am about to share in this video today. If this is your first time on my channel, I am Dr. Saul Whitman, Chief Medical Officer at Northern Institute for Society Wellness, with over 30 years treating thousands of patients with heart disease, atherosclerosis, stroke, and high blood pressure. And now, let us get into the video. What is NIPAH virus, and why is it a threat to us? NIPAH virus was first discovered in 1998 in Malaysia when 105 people died in a mysterious outbreak. Scientists discovered that this virus comes from fruit bats, creatures with wingspans up to 5 feet that live in large colonies throughout Southeast Asia and South Asia. Now here is the part you need to pay attention to. This virus does not just spread from animals to humans, but also spreads from person to person very effectively, especially in crowded environments like hospitals, airplanes, and restaurants. Think of it this way: if COVID is a tornado, then NIPAH is a tornado with lightning strikes added. It does not just give you fever and cough, but it goes straight to your brain and causes severe encephalitis, making you confused, causing seizures, and possibly putting you in a coma within just days. Research from Mayo Clinic in 2025 shows that among NIPAH survivors, up to 20% suffer permanent neurological damage, like memory loss, difficulty speaking, and personality changes. So why should Americans worry right now when this virus is still mainly in Asia? The answer is very simple. We live in a globalized world. Someone in Kerala today could be sitting next to you on a flight to Los Angeles tomorrow, and the incubation period for NIPAH is 4 to 14 days, meaning that person may have no symptoms when passing through customs, but is already carrying the virus. The CDC has increased surveillance at the 20 largest international airports in America, but as we saw with COVID, once a virus gets in, it can spread very quickly before we can react. Symptoms and how to recognize them. Now let us talk about the warning signs that you and your family need to know. The early stage of NIPAH looks exactly like the common flu, and that is exactly why it is so dangerous. You start with fever, maybe around 100 to 102 degrees Fahrenheit, followed by headache, muscle pain, and fatigue. At this point, most people think they just have a cold or seasonal flu, take a few Tylenol and rest. But with NIPAH, things change very quickly within the next 24 to 48 hours. You start having respiratory symptoms like cough and difficulty breathing, similar to pneumonia. Then comes the scariest part, brain symptoms. You may start feeling confused, not remembering where you are, not recognizing loved ones. Some people have seizures. In severe cases, patients can fall into a coma within just 24 to 48 hours after brain symptoms begin. Think of the brain like a sophisticated computer that controls everything in your body. NIPAH virus is like a hacker breaking into the system and destroying everything from the inside out. It causes encephalitis, meaning your brain swells up, But your brain sits inside a hard skull that cannot expand, so when it swells, it gets compressed and brain cells start dying. This is why the fatality rate is so high and why time is the most critical factor. If you or someone in your family has flu-like symptoms combined with confusion or changes in mental status, and especially if that person just traveled to South Asia or Southeast Asia within the past 2 weeks, you need to get to the emergency room immediately and tell the doctor about travel history. Do not wait to see if symptoms go away on their own, because with NIPAH, every hour that passes can make the difference between life and death. Why we do not have a vaccine or treatment yet. This is the part people ask me about most. If this virus is so dangerous and has been known since 1998, why do we still not have a vaccine or cure? The answer really frustrates me with our global healthcare system. NIPAH primarily affects poor countries in Asia where there is not enough money to invest in expensive vaccine research. Big pharmaceutical companies in the West do not see enough profit in developing a vaccine for a disease that only has a few hundred cases per year in remote places. But now that WHO warns that NIPAH has the potential to become a global pandemic, suddenly everyone is starting to care. But there is some good news. Scientists at Oxford University are developing an experimental vaccine and have had promising results in animal trials. However, this vaccine still needs to go through multiple stages of human clinical trials and could take another 3 to 5 years before approval. Meanwhile, we only have supportive measures for treatment, meaning helping your body fight the virus rather than having medicine that kills the virus directly. Doctors will put you in the ICU, put you on a ventilator if needed, control fever and brain pressure, and hope your immune system is strong enough to beat the virus. It is like when your house is on fire, but firefighters can only help you get out and prevent the fire from spreading to other houses, but there is no way to put out the flames directly. This is why prevention is the strongest weapon we have right now. And that is exactly what I will tell you about in the next section: how to protect yourself and your family. All right, now we get to the most important part that I want you to remember and share with everyone you know. Even though we do not have a vaccine, there are many things you can do to minimize your risk of NIPAH infection, especially if you plan to travel or have family members traveling between America and South Asia. First and most important, if you are planning to travel to India, Bangladesh, Malaysia, or any country in Southeast Asia, check the CDC travel warnings before you go. During NIPAH outbreaks, the CDC typically issues specific warnings for each region. When you are there, avoid contact with bats or areas where bats live, especially places with fruit trees. Do not eat fruit that has fallen or shows signs of animal bites because bats may have contacted them and left virus on them. Also, avoid drinking fresh coconut water from street vendors if you see bats flying near that area. Second, if someone in your family or community just returned from these areas and has flu-like symptoms, encourage them to wear a medical mask and limit close contact with others until certain it is just a common cold. I know this sounds excessive, but remember the lesson from COVID. Early mask wearing saved many lives. Third, maintain good hand hygiene, especially after international travel or when in crowded places like airports. Wash hands with soap for at least 20 seconds or use hand sanitizer with at least 60% alcohol. This virus can survive on surfaces for several hours, so avoid touching your face before washing hands. Finally, if you work in healthcare or care for sick people, make sure to use full personal protective equipment when in contact with any patient who has encephalitis symptoms or has travel history to NIPAH areas. In previous outbreaks, healthcare workers accounted for a high proportion of infected people because they had direct contact with patient body fluids containing very high concentrations of virus. What will happen if NIPAH comes to America? Now, I want to be straight with you about the scenario that the CDC and health experts are preparing for. If NIPAH appears on American soil, we could face a situation much more serious than the early days of COVID, and I will explain why. With COVID, the average incubation period was 5 days, and many people had mild symptoms or no symptoms, which, while making the virus spread quickly, also gave us time to build field hospitals and increase ICU capacity. With NIPAH, when someone has symptoms, they quickly become very sick and need intensive care immediately. This means our hospital system, already overloaded after COVID, could be overwhelmed very quickly. Each NIPAH patient needs a special negative pressure isolation room to prevent the virus from spreading through the air. And most hospitals only have a limited number of these rooms. On top of that, The high fatality rate means the psychological impact on the community will be huge. People will be much more scared than with COVID because they know that if they get infected, the chance of survival is only 25%. But this is why I do not want you to panic, but instead prepare. The CDC has learned many lessons from COVID and now has specific response plans for NIPAH. They have trained rapid response teams in each state, stockpiled protective equipment, and established rapid isolation protocols. Major airports already have thermal scanners and screening systems for passengers from high-risk areas. If the first case is detected, they will quickly trace all contacts and put them in isolation to stop the chain of transmission. The key here is early detection, and that is why raising awareness in the community, like what we are doing right now, is extremely important. If people know about NIPAH and its symptoms, they will go to the hospital earlier, doctors will think about NIPAH when asking about travel history, and we can prevent one case from becoming an outbreak. All right, everyone. We just went through a lot of information about NIPAH virus, from its origins, why it is dangerous, symptoms to watch for, and most importantly, how to protect yourself and your family. I know this information may sound scary, but remember that knowledge is power, and being well prepared is always better than panicking later. If you found this video helpful, please share it with your loved ones, especially those planning to travel or who have family in South Asia and Southeast Asia, so they also know how to avoid NIPAH virus. And please like my video so it gets recommended to more people who need this information. You can comment below if you have questions about NIPAH or if you want me to make videos about other medical topics, and I will answer each comment one by one. Thank you for watching, stay healthy, and see you in the next video.